This is Dr. James with Helpmommy, and in my last video, we questioned, does COVID-19 warrant a vaccine? And through the sniff test of morbidity and mortality, yes, it does deserve a vaccine. So let's talk about our current state of COVID-19 vaccines. Is it a good vaccine? Was it done correctly? I'm just going to come out and say it. No, both counts. It wasn't done correctly. It's not a good vaccine. So let's go through this. Before COVID-19, the fastest we'd ever approved a vaccine was 4 years. Most of the time, it took a long time, like 10 years to develop. Why does it take so long? Well, one of the big things was that the companies had to go through these very stringent things just within themselves to see whether it was financially viable. Could they make the vaccine, and could they test it, and then could it be put out in the community and things like that? Well, we removed that. The government said, hey, we're going to take away that. You have no risk. Just go develop the vaccine. Was that a good or a bad thing? I think it was one of those things that was a national emergency. There was lots of disease. I think trying to remove financial disincentives of developing the vaccine was probably a good thing to get it at least done faster with a step that's kind of artificial. As far as politics and stuff like that and money spent, I'll leave that to the politicians and the financial people. But it is a step that could have been removed, and it didn't really have anything to do with the scientific basis of the vaccine. So I don't have a problem with that. But then in the testing, they spent a lot of money paying people to let them test them on it. Do I think that was okay? Yeah, that gets done anyway. So I think that having the money to do that was fine. I think my problem was the timing. I don't think we tested for long enough. For one, you need to test to make sure that it's effective. So in the effective part, you need to have had a long enough period of time to watch the people you vaccinate versus the people that you didn't vaccinate, watch them through multiple situations and see if it worked. I don't think we did that long enough. And I definitely don't think we watched it long enough to see what long-term sequela or problems with the vaccine could be. That was definitely shrunk down way too low, especially in the area of children who have a very long lifetime. So watch for part 2 of this to see what else I think is wrong with the vaccine.